The question for today is a 45-year-old male, vegetarian by diet, complains of easy fatigability. CBC was done with showed pancytopenia. Liver function test showed mildly elevated levels of bilirubin. On examination, pallor was present and there was hyperpigmentation of the knuckles. What could be a possible diagnosis? Iron deficiency anemia, pure red cell aplasia, aplastic anemia, vitamin B12 deficiency, and this is the hyperpigmentation of the knuckles which is shown, right? So if you want to summarize this question, it's actually a middle-aged male who is presenting with easy fatigability and pancytopenia with mildly elevated levels of bilirubin, and there was hyperpigmentation of the knuckles. So remember, this hyperpigmentation of the knuckles with a background of anemia and mildly elevated bilirubin is pointing to the diagnosis of vitamin B12 deficiency, right? Vitamin B12 deficiency, right? So vitamin B12 deficiency. So what you should know about vitamin B12 deficiency? So vitamin B12 has certain important roles. So it can present, deficiency of this can present as pancytopenia. It can present as anemia also. One more presentation which everyone should know is it can have neurological manifestation. It can present with numbness as well. So in the human body, it has got certain function. So you have different forms of vitamin B12. One is called adenosyl cobalamin and another one is called methylcobalamin. Okay, so the function of methylcobalamin is to convert your homocysteine to methionine. That's the function of methylcobalamin. And the function of adenosyl cobalamin is to convert your methylmalonyl CoA to succinyl CoA. Okay, methylmalonyl CoA to succinyl CoA. So why you should know this is, when you have deficiency of the enzyme cobalamin, what happens is this conversion doesn't take place. So what happens if this doesn't take place? You will have elevated levels of methylmalonyl CoA and you have elevated levels of homocysteine. So what will happen if you have elevated levels of these? So elevated levels of homocysteine can lead to thrombosis. So it's a risk factor for development of thrombosis. So if you have elevated methylmalonyl CoA, the byproducts can be excreted in urine. So you can have increased methylmalonic acid in urine. And another one thing is it can get converted into methylmalonate and propionate. And these are abnormal fatty acid which can get incorporated into the cell membrane of the nerves. So that's why you have neurological manifestations. So you should remember these two things, adenosyl cobalamin and methylcobalamin, and the patients can present with pancytopenia or neurological manifestations, right? So you can have hyperpigmentation of the knuckles. So next thing is, what does the peripheral smear show? So in the peripheral smear, you can have macrocytes. It's basically a macrocytic anemia. So the RBCs will be bigger and you have hypersegmented neutrophils. That means neutrophils with more than 5 segments. So here you have almost 8 to 9 segments. So you can have hypersegmented neutrophils, right? When you see the bone marrow, you have something called giant metamyelocyte. So you have different stages of development of WBCs. So you have myelocyte, promyelocyte, then metamyelocyte, then band forms, then neutrophils. Like that you have different forms. So what happens in your vitamin B12 deficiency? You have something called folate trap. So what happens if folate gets trapped? Then your thymidine and other nucleic acids, no, all those will not be synthesized properly. So your nuclear maturation will not happen, but your cytoplasmic maturation can happen. That's called nuclear cytoplasmic asynchrony. So the nucleus remains big. Okay, so that's what happens and you get giant metamyelocyte. So where do you get pigmentation of the oral cavity, your lips and all? Can happen in Peutz-Jeghers syndrome. So remember, vitamin B12 deficiency can present with pancytopenia, neurological deficits. They can have hypersegmented neutrophils and giant metamyelocytes. Thank you.